Okay, thanks everybody for being here again. I am excited to see all of you. I'm going to go ahead and open the floor for anybody to share events or activities or anything that y'all want to share with the full group. Um, just a reminder too that if you haven't already, if you'll sign into the chat with your name and organization, and the floor is open for whatever y'all want to share.
Hi, Julian. This is Randy Byington, ETSU Rural Health. For those of you who know sort of a little bit about what I do with the closing of Little Milligan Elementary School next fall, this coming fall, I'll be moving to Hampton Middle School and working with the med students at that location.
Hey, this is Tia with Bridge to Shore. I just wanted to announce again our Bridge to Shore Recovery Jam. It's the second annual one, happening June the 30th at the Hickory Tree Grocery. So I am going to put the vendor and provider registration in the chat because I am closing that registration in about 4 days. So we would love to have you all. We're going to have 6 bands in total, all kinds of people coming out from the community. And so would love to have some of you all come and set up a table and be able to give out good things to the people who are attending. Thanks.
Hi, I'm Chelsea Isaacs from Elizabethton City Schools. We are ramping up for our back to school bash that is going to be on July 29th. We're once again going to have the resource fair like we did last year. So I'm going to drop our vendor form in the chat and please sign up and come give out your resources to our families. Thanks.
Hey, I am Brittany Peeler from Johnson City Recovery Center. Not this weekend, but next weekend, we are having our big fundraiser cookout. We're going to be grilling out hamburgers and hot dogs. We'll be playing cornhole and badminton. Jeremiah L. is going to be our guest speaker. We do ask for a $10 donation since it's our fundraiser, but we're not going to turn anybody away, so everybody's welcome. Come bring your family and friends. That's June 15th. And it's a different location. So it's not at Johnson City Recovery Center this time. It's at High Point. So I will put the flyer in the chat.
Hello, this is Amber Sluter from Carter County Schools. We also have our back to school bash that I have reached out to some of you all today about setting up a table at. If you're interested, that is July 27th from 10 a.m. to 3 p.m. at Hampton High School. So if you would like to set up a table or a tent, you can call Harmony Free Will Baptist Church or let myself know, and I can let Mr. Brenningham know. Also, I have working to start a CIT coalition here in Carter County. I met with our commissioners the other night. So if you're interested in joining the coalition or becoming trained in CIT for Carter County, please reach out to me and let me know.
Hey, will you share what CIT is for anybody that may not know?
Yes, so crisis intervention team. A lot of our police officers and others are trained in it already, but it's a crisis intervention training. It's a 40-hour training. It covers a lot of different topics such as mental health, addiction, substance use, and really the coalition with some of our officers being trained already and such. We are really working to start a coalition here in Carter County because we don't have a coalition, regardless of some people who have already been trained. The coalition is more so a monthly meeting or, every other month meeting to discuss and review cases and talk about the best practices and such of how we can approach individuals who are experiencing mental health illnesses or, any barriers in our community or any organizations that we may have as resources for officers or others who may not know the resources that are available.
Is your contact information in the chat, Amber?
It is not, but I will put it in there right now.
Hi, everyone.
Hey, I'm Ellen.
Go ahead, Ellen.
You go first.
Hi, everyone. This is John Knack with Creekside. We're having our second annual behavioral health fair with vendors from all over the region on June 20th from 10 to 2. If anybody wants to tour Creekside or come by, you could be a vendor, or you can just come by and visit and pick up information. Last year, we had about 25 different vendors. Also, for the school folks, I put in a flyer in the chat. We're having basically behavioral camp for kids this summer. There's 3 sessions. There's a lot of really cool life skills, bullying, self-esteem, just all kinds of different topics that are going to be discussed in this behavioral camp. And TennCare pays for it with any kind of diagnosis of anxiety or depression. And again, my information is in the chat. Thanks for letting me share.
Hey, I'm Ellen Sturgill. I am with Insight Alliance, and I am a what's called a first responder rest coordinator. We are, myself and Casey Ferguson, that some of you are familiar with, we are building a program out here, and it is for Carter, Hawkins, Johnson, and Washington County, where we would strictly be a resource and get referrals from first responders, so law enforcement and EMS. And we basically would get referrals, and then we could do care coordination for those participants for 12 months. So we're kind of just getting the word out. This was piloted in Middle Tennessee for almost the last 5 years, and they've had great response in their numbers, and just trying to get that niche, almost the term is deflection, but get that niche of people pre-arrest to see if we can get them into treatment and just kind of know that recovery is possible. So if anybody has any agency connections in those counties, again, Carter, Hawkins, Johnson, and Washington, we are just really building those relationships right now. And we have a really thorough network of getting treatment. So thankfully, treatment's covered. Just now getting into those agencies and letting them know we're a resource to kind of take some of their load off rather than taking people to the jail. So let me know if you have any questions. I'll put my information in the chat again.
Hey, Ellen, this is Gabby Smith. I've got a quick question for you about that.
Yes.
Is this something that I know you said with first responders, law enforcement, that type of thing? Is this something that you guys could offer case management wise for families who are involved with the Child Protective Services or just DCS in general?
Yes, if they get technically a referral from law enforcement, let's say law enforcement was involved in removing the children or something, and they express that they want help. All we need is a referral from that agency. So whether it's EMS, which fire is usually part of EMS, right? EMS, fire, law enforcement, and we can go from there. So.
Okay. I think I'd love to chat with you outside of this, of just kind of how to get the CPS investigators involved too, because I know we have a lot of kiddos that are removed because of substance use in the home. And the parents are kind of told like, hey, you need to have this many clean drug tests and this and this and this, but then there's no direction of where to go from there. So I think it would be a really good connection there, but I see Amber nodding.
Yes, what a great niche.
Chat
Yes,
about
because it's, you'll see these families, and it's basically anyone with substance use disorder, because anyone that's risk of overdose, which now we know that polysubstance, I mean, it really doesn't matter what substance necessarily. So yeah, that would be great. And it's the police may not have cause, and then they have discretion to charge them or not. So that's exactly the niche of what we're looking for. So that'd be great, Gabby. I'll shoot you an email because I do have your information.
Okay, sounds good. Thank you.
Okay, awesome. And then I didn't see Amber nodding. I don't have the full thing, but
yes, yeah, I can email you as well. I'd like to chat more, especially if we're going in with a CIT approach and adding that too.
yes, that'd be great. Yes, thank you so much. I'm glad we made the connection. Thank you.
I'm going to share real quick. We at Carter County Drug Prevention have a couple safe sitter classes coming up. I've got one scheduled for June and one scheduled for July. These are really fantastic opportunities for kiddos that maybe are babysitting younger siblings, who have working parents. Really, I have trained all of my kiddos in it, because I think it's just a great kind of has some great lessons for them. There's everything from basic child development to basic first aid, behavior management, all kinds of good stuff. So it's a $35 class, but we don't turn anybody away who can't pay. So on the Eventbrite, there's, they don't have to email me and say I can't pay or any of that. There's two options on the Eventbrite. One is I'm going to pay and one is I'm not going to pay. And so I'm going to share both of the Eventbrites for that if y'all wouldn't care to spread the word about those to any kiddos that may be interested. Anybody else have any events, activities, updates, anything you want to share?
What ages is that for, Jillian?
So it's recommended for kind of 6th through 8th grades. I've done it with kiddos as young as like 4th grade, and then I've done it with high schoolers. So it's pretty adaptable. I can kind of make it work with whatever. I'll also mention that in the first aid piece, I also do Narcan training with them, to give them that as well. So really anybody that is you feel like is on that level that could navigate those things, I'm happy to have.
I also was going to mention, when I spoke to the commissioners the other night, we also mentioned mental health first aid. And I know a lot of us on here are instructors or have instructors within our organizations. And so that's something that I presented to them as starting to branch out and leak out into our sheriff's department, city police, our county commission officer, and our mayor is very, very much on board, and willing to do, however she can help us start implementing that. So if anyone also is interested in that, I know a lot of us are instructor trained. We're hitting our SROs at the end of July, but we're also trying to get other additional officers and such to attend to. So if anyone is interested in that, or helping with that, we will always take help with that also.
All right, y'all, last call. Anybody have anything else you want to share? Okay, well, I will open the floor back up after our speaker if y'all think of something, or feel free to put updates in the chat as well. So at this point, we're gonna go ahead and transition into our speaker portion of the meeting. So today we have Adam Clark with us, who's gonna share about his work and hopefully some ways that people can get connected with him as well. So Adam, I'll turn it over to you.
Yeah, thank you. Will I be able to share my screen?
See if you can share now.
All right, let's see. Is that working?
Yep, that's
Oh, perfect. Okay. All right, so yeah, like she said, my name's Adam Clark. I'm the Northeast High Impact Area Coordinator with the Tennessee Department of Health, and specifically ORCO, which is the Overdose Response Coordination Office. If anyone has any questions on anything, you can feel free to stop me, or if anyone puts it in the chat, maybe Jillian or Tyler, you can let me know. So this is the HIA map, and how Tennessee kind of breaks up the HIA program. Obviously, we're here in the Northeast, and you have the East, Chattanooga, and then kind of surrounding Nashville, and then all the way over in the West with Memphis. So some ways and some platforms that we're able to monitor overdoses. I'll go over all these in a little bit more detail. But with the monitoring, we're really looking specifically for spikes. So that could either be a geographic region, maybe a specific demographic, or if overdoses are linked to a specific substance. So maybe there's a bad batch and additional people are overdosing because of that. So the first kind of platform is ODMAP, and this is definitely the best platform and the quickest way to determine if a spike is occurring. But then on the flip side of that is it's not statewide, and only in specific areas. So like for our region, really only mainly used in Sullivan. There are limited uploads in Washington and Carter by the TBI, but those are very limited. And like it says there, just a web-based tool providing real near-time surveillance of suspected overdoses. So the way this works is EMS or law enforcement would connect their record system to ODMAP. And then anytime a report is generated in their system that is kind of coded as an overdose, it would populate a dot on the map. And usually this occurs pretty quickly, usually within a few hours. Sometimes it can take a little longer, but it's always usually within kind of a day period. So ESSENCE, this just stands for Electronic Surveillance System for the Early Notification of Community-Based Epidemics. So this is, I can go in, build searches based on complaints and discharge diagnosis at hospitals in the region. So it's ER data, and I sort it by patient location. You can also sort it by hospital location. But I can build searches for overdoses. It's updated daily, and then these are would be non-fatal overdoses. So this is kind of what it would look like. This isn't for Carter specifically or anything in the region. This is just something I pulled online, but this is what it looks like. So it runs an algorithm, and then anytime there's kind of a certain standard deviation outside of what the algorithm expects the overdose count to be, it either populates a yellow dot or a red dot. And then with this, you kind of have to go in and look to see if it's actually one, if it is an overdose, or two, is it the type of spike that we would be concerned with. So a lot of times with this, if people have a history of like opioid dependence, they might have that as a ongoing code. So they would kind of pull in anytime they present to the ER. This also pulls in stuff like intentional overdoses, or if people are overdosing just over-the-counter medication. If kids get into, maybe kids get into their parents' medication, they would show it here. Any type of like Delta 8 gummy situation, that would also show up here. And yeah, so for this, someone has to present to the one of the hospitals in the region. So the DOR, the drug overdose reporting, they have a dashboard which I'll show you here shortly, but these are records that are shared to the Department of Health from hospitals, but these are based on billing codes, so it's after the fact, and usually there's a 2 to 3 week lag in the data. And this only collects records on illicit drugs, so this wouldn't pull in any of the over-the-counter medication or anything like that. But here's some, so this is from the DOR, and here's some of the overdose data for the region. So the top line there is for the Northeast region, not counting Sullivan. So the other 7 counties, and then the bottom line is Sullivan pulled out. So, and then obviously for the dots closer to the right side, those are still being updated, so that's not necessarily completely accurate. And then again, these are only overdoses that people present to the hospital for. As we know, a lot of overdoses are just going to be occurring, and people aren't either going to call EMS or present to the hospital. But it's some data that we can look at and kind of see what's going on. So this is Carter specific, and yeah, again, the points to the closer to the right might not necessarily be completely 100% updated. And then just some resources I can point people towards for maybe some additional information. This is the dashboard, and it updates. So usually, like the overdose deaths portion, that will only update once a year, and then not super timely, but they do release a report once a year. So if you go to additional facts and figures, which I circled at the top, and then the 2022 overdose death report. So this is just a graph pulled from that report. So the most recent report was released in February of this year for the 2022 fatal overdose statistics. And this is the first time that the rates were kind of leveled off in a while. So I think that's a good sign. We'll have to see what the 2023 numbers look like. And I would say usually they get released the last quarter of the year. So hopefully we get it at some point, maybe November, around there. But in the meantime, so this is a graph or kind of statistics from the CDC, where they get sent the death data. So they're predicting for 2023 in Tennessee a little over a 3% decrease in overdose deaths. We'll have to see what Tennessee, like the finalized numbers for Tennessee when the actual report comes out from the Department of Health. But just kind of a little more information. Potentially it could could be going down for 2023. So I think this is a good slide because a lot of people ask me why the fatal overdoses take so long to report. So this kind of just lays it out. I'm just kind of following the chart here, but the death is reported to the medical examiner. Investigation takes place to determine jurisdiction. Most of the time, an autopsy is ordered, and then they issue a pending death certificate. And then based on the autopsy, usually toxicology, sent to the lab. Depending on what that says, it's then finalized on the death certificate. That's sent to the CDC. The CDC generates the coding, and then the kind of fatal overdose is added to the Tennessee count. And they only release the numbers. Their file is kind of finalized at the end of August. So for 2023, their file will be finalized August of 2024. So a couple months here, and they have to do the report and publish that. So that's kind of why there's a lag in the death data. And then just going back to the additional facts and figures, they also have some reports that they do. So for example, I know one of the kind of drugs we're focusing on in the region right now is xylazine. So here's a xylazine report that they put out pretty recently. And again, the death aspect, it only has the 2022 data, but has some good information in here. And then, yeah, my contact information, if you want to email me, call me. I will be at the live Health Council meeting next week. So if you think of any questions in the meantime, you can ask them in person if you want to. Anyone have any questions or comments, concerns?
Adam, I have a question. This is Gabby.
Yeah.
Just out of curiosity, do you know what county in our region had the highest number of overdose from the data that you have? Was that Sullivan?
Yeah, so are you asking like deaths or just overdoses in general?
Just overdoses in general.
Yeah, Sullivan. And then I would have to look at the DOR to see kind of the next regions, but it's probably Washington, and then Greene, if I had to kind of guess. But again, the data we have is only from overdoses that are presenting to a hospital.
Mm-hmm.
And a lot of them are just never going to present.
Right.
So.
Do you know how our region fares in comparison to the rest of Tennessee? Are we higher in overdoses? Are we about the same as Middle and West Tennessee?
That's not so. Yeah, I didn't look up that data, but I can get back to you.
Okay, just curious. I know in the work with TCCY and kind of what we were talking about with Ellen earlier, if you look at a heat map as to why children are removed from the home in our region, or in the state, really, our region is highest usually in removals due to substance abuse in the home. So just curious if it tracks with that as well.
Yeah, I can definitely look at that and get back to you.
Awesome. Thank you.
Yeah, no problem. Ellen?
Hey, so yeah, kind of same question, just to clarify. So where you're getting the reports for the map is it's the hospitals, it's not the first responders or law enforcement?
Correct. So the essence and the DOR is so the essence is based on complaints and diagnosis. And then the DOR is based off the finalized like billing codes after the fact.
Okay.
The OD map, that would be based off of EMS and first responders, but that's really only in Sullivan.
Yeah, I knew. Okay. I wanted to confirm that still was kind of happening. Sullivan's the only one. Okay. And that was complaint, like, so chief complaint based on what's on um the medical record, or chief complaint, the EMS chief complaint. You have that
Yeah, so
data too.
it's based off the medical record. Sometimes there's like
Okay.
triage notes that give more information as to kind of what's happening, but that's kind of hit or miss. Some of them don't have any, some are like not very good. So it just kind of depends.
Yeah. Okay. Okay. And there's probably of course, no way. So technically the numbers are underreported is what we could say.
Yeah, I would think so, because
Okay.
the data we have is only from hospital data.
Okay. Awesome. Thank you so much.
Yeah, no problem. Well, anyone else? If not, I mean, if you think of any questions, just shoot me an email, shoot me a text.
How do you raise your hand? I can't see that on mine. This is Tony DeLuzio.
Go ahead, Tony.
I put it in the chat. I'm sorry I sound gravelly, but I think I picked up something from my last trip west. But I put in the chat about out west, it's Shelby County. It doesn't talk about the Jackson metro. Why is it so regional in the east? Chattanooga, Knoxville, Tri-Cities, big time regional, of course, around Nashville, and then just a single county out west. It seems to me like that's really disproportionate when you're talking about, and I put in COVID, we're really raising the flag about things which are shocks to our resilience, like COVID, like, you know, the extreme mental health duress that caused people, including our very young, to have to self-medicate or to be liable to somebody saying, hey, I've got something for you, try it. It just seems ridiculously inappropriate to have this kind of east to west gradient when we could really be looking at Tennessee as a whole is one of the worst. If you look at data, is one of the worst. And it is probably has a lot to do with all the different borders that we have, things creeping in, and also some of the socioeconomics, which are common between racial, ethnic, social poverty, social determinants of health. It's, it's kind of like, duh. You know what? Why aren't we doing this? Sorry, I went on so long.
Yeah, no problem. So I would say that's just how the HIA program is set up. They kind of picked the areas that were hit the hardest with the overdoses. So that doesn't necessarily mean that there's not coalitions over there doing work and, harm reduction.
Gotcha.
It's just the specific program that I'm a part of through ORCO, the Overdose Response Coordination Office, just has set it up that way.
That's good to know, because when we were doing our conferences with veterans, we specifically reached out to state agencies, and we had Elizabeth Hart come up from Nashville, and it was pretty profound to see what the state was really thinking about this kind of stuff.
Yeah, and Catherine put in the chat, in the east, it's availability as well. The roads and the traffic of drugs, guns, people is a huge impact. I mean, yeah, I think I saw Kathleen on here, but me and her are part of a group, the I-81 task force, where we meet with people in other states along I-81, and kind of right now we're kind of working on a xylazine project. But yeah, I would agree with the the different interstates and stuff like that. Well, yeah, if no one else has anything, Jillian, thanks for giving me some time.
Thank you, Adam. And I think Adam, if you don't care to put your info in the chat again, just so
Yep, I can do that.
Everybody can find it. That will be awesome. Thanks for being here and for sharing. If I can have, so we're gonna move into our committee. I'm sorry, y'all, my kids are so loud today. Like they are in there playing Fortnite, like living their best lives, and they are so loud. So we're gonna move into our committees at this time. So if I can ask each of our committee leaders to share just a little bit about what your committee's got going on, so that way folks know if they want to join you today.
Hey, this is Tia with Committee A. So we're still touching base on the events. We have a bunch of international overdose awareness events coming up. So we're going to kind of touch base on that. And then when we meet in person next week, we're going to kind of look at the trainings that we're going to try to funnel through the CCC.
This is Gabby with Subcommittee B. We're talking about kind of our next steps with the Food Insecurity Initiative. We're talking about doing some gardens in Carter County schools. We've got a lot to plan today, and I'm really excited we actually have some movement in that effort. And then hopefully we get a chance to also chat about our mental health efforts in that committee as well.
Somebody from data collection, y'all want to share what you got going on today?
I'm not sure if Tyler is joining our group or if he was going to share anything. But I have taken a new role, so I can't be the committee lead of this committee anymore. So I'm sure we'll be discussing the future with that and having someone else take over Committee C. And then I know Tyler's got some updates with his intern, and we're working towards our strategic plan, working on the brochure with our information from our CHA, I believe.
All right, y'all. I'm going to go ahead and open up the breakout rooms, and y'all are welcome to join whichever one you want. And then when your breakout room is finished, you are free to go. Thanks for being here.